Welcome, everybody. This is so incredible to see so many people coming to be with us today for the webinar. Welcome to the Internationally Educated Nurse Transition to Practice Placement Program webinar. This session is designed for healthcare organizations and internationally educated nurses, and really anyone who wants to learn more about this program. We are a large group, so just a few housekeeping things before we begin. There will be a question and answer period at the very end, so please save your questions till then. If you would like to have your camera on.
Leanne, can you unmute Morgan? Somehow she cannot unmute herself. Anna, we cannot hear you. Anna?
I think I can unmute now.
Now you're good, but we cannot hear Anna now, so keep going.
I'm
Morgan.
Back.
Okay.
I was kicked off the webinar. I'm sorry for that.
Don't worry, we never will kick you out, and Morgan is here, so let's keep going. Thank you.
Wonderful. If everybody would like to have their cameras on, great. If not, that's okay too. And if everybody could keep themselves muted, that would be lovely as well, just to minimize background noise. And then we will record the session to be watched afterwards.
Okay, can we go to the next slide? Can we go to the next slide?
Carrie or Leanne, can you move the slides, please?
This is at the land acknowledgement.
Oh,
Put
sorry.
the land acknowledgement.
On my screen, I'm seeing the beginning slide. So before we move fully into the webinar content, I'd like to begin in a good way by grounding us with a land acknowledgement. As we come together for this webinar, whether joining virtually from different regions or gathered in shared spaces, it's important to recognize the lands we are learning, working, and caring on, and the Indigenous peoples who have stewarded them since time immemorial. RNAO's work and the work of our members takes place on traditional Indigenous territories across Ontario. RNAO's home office is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also acknowledge that Toronto is covered by Treaty 13 under the Toronto Purchase Agreement with the Mississaugas of the Credit. Today, this land is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back more than 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. So I'm honored today to introduce our webinar presenters. Today, you'll hear from Dr. Doris Grinspun, who is the Chief Executive Officer at the Registered Nurses Association of Ontario, myself, Morgan Hofarth, the Director of Membership and Services at RNAO, and Anna Horst, who is the Nursing Recruitment and Retention Manager. And we'll also hear a little bit later from one of our partner organizations, and we'll introduce them right ahead of their presentation time.
Wonderful. So before we, now that we've made introductions, I'm just going to take a moment to share a little bit about the broader nursing recruitment and retention program here at RNAO. So RNAO is building a nursing recruitment and retention program across Ontario. We know that recruiting nurses is only part of the challenge, but keeping nurses in the profession is a little bit harder. And so that's really at the heart of what this recruitment and retention program is going to be about. So practically, we will focus on working directly with nurses and organizations that employ nurses and partnering to help with retention efforts, offering resources and tools that organizations can put to use to help with recruitment of nurses in Ontario. We'll also be leading a range of other activities aimed at helping nurses stay and thrive in the healthcare system here. And so today's session is kind of a part of this broader program in terms of nursing retention. Internationally educated nurses are the focus of this specific program and initiative. And it's just a really good example of how we're putting these goals into action at RNAO and helping qualified nurses find their place in Ontario's nursing workforce and supporting the organizations that employ them. So with that context in mind, we'll turn to what we'll be covering next.
So today we are going to go over the
Morgan,
sorry.
we can't hear you.
Can you hear me now?
Yes.
Okay, sorry. Today, what you can expect to get out of the program. So we'll introduce the IEN Transition to Practice Placement Program and why it matters here in Ontario. We'll explain how placements are organized and what a typical placement will look like. We'll walk through how to apply and how participants will be chosen. Don't worry, we'll cover all of those details later. We'll highlight the opportunities to participate and the supports available to both employers and to IENs. And then we'll invite questions and feedback throughout. And please note there hopefully will be some dedicated time at the end, depending on how long the discussion goes today, but there is the chat as well as the Q&A feature that are enabled for this session. And if you do put something in the chat or the Q&A and we don't get to it today, we will put together a frequently asked questions section and send it out after the presentation today.
Wonderful. So we just want to start off by talking about why this program matters and why we are doing this. So according to CNO's report from 2025, the Nursing Statistics Report, IENs are a big driver of nursing growth in Ontario. And the report actually states that IENs account for more than 53% of new RNs entering the nursing profession. But despite that, and what we hear very often at RNAO is that IENs are still facing significant barriers when they're looking for employment as an RN in Ontario. So some of those major challenges are a lack of nursing experience in Ontario, lack of placements, limited professional networks, and generally just a difficult time trying to secure their first RN job. So we know that registration alone doesn't guarantee success in getting an RN employment in the workforce here. And in fact, that report also states that IENs are less likely than Ontario educated nurses to even renew their nursing registration after their first year, which suggests that there are ongoing challenges related to employment and retention of internationally educated nurses. So this is why our program is specifically designed to support IENs to successfully transition into practice, build confidence, develop a professional network and professional connections, and to really feel a sense of belonging within nursing in Ontario. So the challenge is no longer getting nurses here to Ontario. It's making sure that they have support, opportunities, and the pathways that they need to thrive as nurses here. So having said that, Morgan will kind of go into the program details for everybody.
So before we get into the details of the placements and supports, I'd like for us to go through the structure of the program so that you have a good understanding of how it will be delivered. This is a time-limited program that will conclude in June of 2027. We do have a tentative start date of this September 2026. The program will be delivered using a cohort model from September through to next June. And we're currently looking to collaborate with organizations who would like to be placement partners. So for healthcare organizations, this means identifying potential placement opportunities and exploring how the program aligns with your workforce needs. We're also opening the application form to internationally educated nurses who are interested in participating in the program and who meet the eligibility criteria, which we will go over shortly. Once the applications are received, RNAO will review and assess the applications to identify participants for each cohort. Because we anticipate significant interest in this opportunity, unfortunately, not all of our eligible applicants may be selected. So looking at the number of participants we have on our webinar today and knowing that there is a limited number of placements, limited to 100 participants, we will have to make some selections. So selected participants will then move into the orientation and workforce readiness component of the program. Before beginning their placements, participants will complete 4 virtual orientation sessions, which are about 90 minutes in length. These sessions are designed to help participants better understand the Ontario and Canadian health system, workplace culture, professional expectations, communication and collaboration practices, and other key aspects of nursing practice in Ontario. Our tentative plan is for the first cohort to begin orientation in September, with clinical placements following shortly after completion of the orientation training. So can you go to the next slide? After the mandatory orientation training, participants will move into one of the most important aspects of the program, which is the paid clinical placement component. Placement partner organizations will serve as the employer for the duration of the placement and will hire participants into temporary RN or temporary RN placement positions. Placement will be up to 6 weeks or 180 hours, providing participants with exposure to Ontario nursing practice in a real-world healthcare environment. Each participant will be assigned to a preceptor who will help guide their learning, integration into the team, and understanding of organizational processes and expectations. Participants will follow the preceptor's schedule, which, depending on the organization, may include days, nights, evenings, weekends, holidays, and so on, following the preceptor's schedule. The placement is intended to provide more than just practice experience. It gives participants a chance to apply their knowledge, build confidence, and develop professional relationships and networks. But also, it does help them to build those connections. Participants will also receive individual career coaching and mentorship support for up to 1 year following the program completion. We know that transition into a healthcare system can be challenging, and mentorship provides an additional layer of support as participants continue their journey towards establishing a successful nursing career in Ontario.
So one of the questions that we've received so far the most is who's eligible to participate in this program. So this program is specifically designed for internationally educated nurses who have already done gone through the registration process, but just have not had the opportunity to secure RN employment. And so to be eligible, applicants do have to be registered with the CNO as an RN. and they have to have been registered for at least 6 months. Applicants must also currently reside in Ontario and be legally authorized to work in Canada and be entitled to practice as an RN with no restrictions. And another key eligibility requirement is that applicants are not currently employed as RNs, as the program is intended to support nurses who remain outside of RN practice, despite being registered and qualified to work as an RN in Ontario. And then finally, applicants must be internationally educated nurses, meaning that they must have completed their undergraduate nursing education outside of Canada. So we really want to make sure that this program reaches those individuals who really, really need it the most, who just have not had the opportunity to work as RNs and who've had to face those, who faced those significant barriers in obtaining their first RN role. And so both for employers and prospective applicants attending today, these eligibility requirements are just there to help us ensure that the program is supporting the population that it was intended to support. So these eligibility criteria will also be present on the application form once that goes live.
So given the, not just the anticipated, but the known interest in this program and a fixed number of placement opportunities being available, we want to be really transparent about how participants will be selected. So all applications will first undergo an eligibility review to ensure applicants meet the program requirements. Eligible applications will then be reviewed using a standardized scoring framework designed to support fairness, consistency, and transparency. The review process will consider several factors, including Ontario healthcare and placement experience, workforce preferences, and alignments with the goals of the program. Applicants will also be asked to submit a resume and a personal statement, which will help us better understand their experiences, career goals, barriers to employment, and how participation in the program may support their transition into nursing practice. It's important to note that there are a maximum of 100 placement opportunities available through this program, and as a result, not all eligible participants may be selected. Selection decisions will be based on the applicant's completed application package and not solely on a single score or an application response. In situations where applications are similarly ranked or where there are significantly more eligible applicants than placement opportunities available in a particular geographic region, we may use additional selection methods, including random selection, to support a fair and equitable process. Our goal is to ensure that the process is transparent, objective, and provides meaningful opportunities for those who can benefit most from the program, while also maximizing available placement opportunities across the province.
Okay, and so because I hope we have lots of representatives from different organizations here, we just want to talk a little bit about why organizations should participate in this program as placement partners with us at RNAO. So while this program has a lot of benefits to participants, it also creates a lot of meaningful value for healthcare organizations. Firstly, participating organizations will have access to a pool of qualified registered nurses who have completed the whole registration process, and they're very eager to contribute to Ontario's healthcare system. And so I think that is the greatest benefit here for healthcare organizations. The placement also provides an opportunity to assess potential candidates in a real world practice setting, right in their own healthcare organization, rather than relying solely on resumes or interviews. And so organizations can observe participants' clinical skills and all these other things that they are very qualified to do and have worked really hard on, and see the overall fit into their teams. For organizations who are experiencing recruitment challenges or retention challenges. They are now connected with potential future employees. Participation also contributes to more of a broader workforce development effort across Ontario. And then by providing opportunities for internationally educated nurses to gain this kind of experience, organizations are helping to address one of those most commonly cited barriers to employment for IENs while strengthening the nursing workforce overall. And then finally, you would have the chance to support inclusive hiring practices and internationally
educated nurses.
I got very so for those organizations with current or future kind of known vacancies, this would be a really, really good opportunity to participate, and I think they would be very well positioned to be a part of this program.
So we recognize that organizations are already facing significant operational pressures. So one of our priorities has been designing a program that minimizes the administrative burden wherever possible. RNAO will provide comprehensive support before, during, and after placements. Before placements begin, participants will complete the orientation and workforce readiness training to help prepare them for practice in Ontario. Organizations will not be responsible for delivering this training. It will all be done through RNAO. We will also manage participant recruitment, application intake, screening, and selection. Our goal is to provide organizations with candidates who meet program eligibility requirements and are ready to begin their placements. Throughout the placement period, RNAO will remain actively involved. We will coordinate the placement activities, maintain communication with both participants and organizations, and be available to help address questions or issues that may arise. To support implementation, participating organizations will receive an employer toolkit and a variety of resources and templates that can be adapted to local needs. We'll also provide evaluation tools and reporting resources to support placement monitoring and program outcomes. Finally, every participating organization will have access to a dedicated RNAO IEN program manager who will serve as a point of contact throughout the program. And we want to emphasize that we understand every organization is different, and we fully expect that there will be organization-specific questions related to human resource processes, onboarding, scheduling, labor relations considerations, and other operational details. We are working on developing and scheduling a separate employer webinar. Once people have completed the employer expression of interest, we'll be reaching out to those employers so that we can talk through some of those specific concerns and make sure that this process and the placements are set up in a way that works for organizations. Next slide. Yep.
So on becoming a placement partner organization, so healthcare organizations do play a critical role by providing the placement itself, identifying a preceptor and creating a supportive environment for participants where they can gain really meaningful experience that they can use moving forward. But I also want to emphasize that, as Morgan said, we recognize every organization is different. There may be questions related to various things, and so we will arrange to meet directly with interested organizations and provide employer webinar to discuss those specific questions. Our goal is to make sure that participation is seamless both for organizations and participants. And so today's webinar was really intended to provide kind of an overview of the opportunity. And then the more detailed operational planning conversations can happen through follow-up meetings and of interested organizations. So if you are potentially interested in participating as an employee partner, we would encourage you to fill out that employer intake form, and we will connect with you, and the forms will come shortly on a future slide here.
So we already have 3 tremendous organizations that partner already with RNAO, KMH, Sudbury, Expanola, Manitoulin, Elliott Lake, OHT, and Northwestern Toronto, OHT. So we are delighted that they are partnering with us. We hope and we would like to see hands in the chat. If some of your organizations, if you can put a thumbs up if you're interested in participating. Also, of course, you need to still fill the form. We're also sure that we have many IENs participating today and that they are absolutely thrilled to hear that there is light at the end of the tunnel. I myself, by the way, am an IEN from many, many, many years ago, and I'm today the CEO of RNAO. So dream big, because many of you, our past president, Dr. Claudette Holloway, our president, our past president, NP Lamo Dolkar, both are IENs, and many, many other people that you know. And you saw here that Sudbury, Spanola, Manitoulin, Elliott Lake, from our president, current president, Sule Boy is from there, also is participating already in this initiative. KMH, Dion Sinclair, soon to be Dr. Dion Sinclair, also participating. Northwestern, with many leaders there, also participating. So with that in mind, I would love to ask, I believe, Kaylin Tenzin, a manager of Nursing Innovation and Transition program, is today here, Professional Practice Office. If you can share that, Kaylin, why is it that KMH is participating? And thank you so much for joining us. Onwards to you, please. Meanwhile, that Kaylin gets access to the slides, let me tell you that this is not the only thing you get from RNAO membership. Benefits include professional liability protection, PLP, which is absolutely included as part of your membership. Professional development opportunities, many webinars, best practice guidelines, networking opportunities, huge number of them, career resources, career counseling is also part of it, and a professional advocacy. Do we have here Kaylin that can share a bit about their interest in the program, and then Morgan, you can talk more about membership.
Colleen, if you can put your hand up so we can find you and all the participants, we can give you, oh, there you go.
Oh, and look at this. Look at this. Join for free is coming. So meanwhile that Kaylin takes over the slides, one more opportunity. Maybe we should launch it today, Morgan, or towards the end of this week. And so people that are not members can join for free. Kaylin, all yours.
Hi there, good afternoon, everyone. Thank you so much for the kind introduction and for sharing this opportunity with us. I'm here to speak on behalf of KMH from our Senior Director of Nursing, Sharita Chambers, and our Chief Nursing Executive, Dion Sinclair. We are really excited at the chance to partner with RNAO to support our internationally educated nursing colleagues. We have a long experience partnership with RNAO from our Best Practice Spotlight organization to advance practice in-house and internationally. And also, we are well experienced in supporting our internationally educated nursing colleagues through our SPEP program, our Nursing Graduate Guarantee Initiative, as well as our clinical externs. So those programs actually sit under me in the Nursing Innovation Transition programs. And we've seen great benefit from having our international IENs join through these initiatives and see the value they bring to the organization in terms of the experience they already come with, as well as the cultural skills they provide in terms of the diversity of care they can speak to. We have a lot of patients that are very diverse, and mental health affects everyone, irrespective of culture, gender, identity, and migration travels with you truly. So the fact that we can have internationally educated nurses who come from similar or same backgrounds, who can really relate to patients, as well as now develop themselves and establish themselves newly in this country and also with a specialty, is something that's been a joy for us to witness and support in. So that's what motivated us to join further in this new initiative. And I'm really excited at all the opportunity that's ahead of us, as well as to meet some more IEN colleagues along the way. In terms of statistics, I can share a little bit from our SPEP program. We've taken part since 2022. We supported 22 SPEP learners since then, of which 14 were hired to nursing roles and 4 into the NGG program itself. So we understand the value of this type of transition and support program where it allows that formal mentorship. It allows the chance to see as well as develop professional skills of how do I network? How do I prepare for an interview? How do I prepare a resume and cover letter? So those are all the things that we provide support already to our extra new grads SPEP, and it's something we would also ensure is available for our RNAO peers as well that join through this initiative. All right, well, thank you so much for your time, and I look forward to working with all of you.
Thank you so much. It's great to hear from our already committed employer partners about why they signed on early to this program, and we're really looking forward to working with you through the placement component of the program. Okay, if you could go to the next slide. Before we wrap up, I want to take a moment to talk about RNAO membership, because this is one of the best ways to stay connected and supported throughout your nursing career. So RNAO is the professional association representing registered nurses, nurse practitioners, nursing students, and internationally educated nurse associates in Ontario. And membership comes with a wide range of benefits. These include professional liability protection, which is mandatory through the College of Nurses bylaws for anybody who's registered in the practicing class in Ontario. It also helps to connect you to professional development opportunities, and helps you access our evidence-based practice guidelines, which are used to support high quality care right across the province. Members also, equally as importantly, gain access to networking opportunities that help you connect with colleagues across the province, with career resources to support your professional growth, and the collective voice of RNAO's over 57,250 members who are speaking out for professional advocacy on the issues that matter most to nursing. I especially want to highlight this for the internationally educated nurses joining us today. If you are newly registered in Ontario, you can, so within your first year of registration, you can join RNAO for free. This is a great opportunity to plug into the profession, to take advantage of these resources, and to start building your professional network at no cost. You can sign, if you go to the next slide, you can sign up using the QR code here, or by going to join.rnao.ca, which will take you to the join page, and you can join for free if you are within your first year of registration in Ontario. We'd be happy to have you all as members and to help you be connected to your professional network in the province. And then if you go to the next slide, if you are outside of your first year of registration, then currently membership is up to 75% off. So you can become a member for the remainder of the membership year for up to 75% off the membership costs.
So nearing the end of these presentations and moving on to questions very shortly, just wanted to put together into kind of a clear next step of what do we do now? Now that we know about this, what do we do? So for employers, there is an employer expression of interest form that we would ask you to fill out. And once we receive that, we will follow up directly and have a discussion and walk through timelines, questions on more of a one-on-one basis, and kind of talk about how this program can fit into your organization and help with your organizational needs. For internationally educated nurses, we would encourage you to review the eligibility criteria to see if you are eligible. We are working currently to have the application go live next week. And so we will send an email to all the registrants with the link to the application form next week once it is open. And if we do have future program communications such as webinars and things like that, we would encourage everybody to come out to those as well.
Now, if I may say a word, please, very quickly. So I don't know what's the split on these 452 participants, which is impressive, between employers and IENs, but I want to speak to the employers first and to the IENs next. To the employers, I want to say I was an employer. I was director of nursing at Sinai, so not only RNAO. And I can tell you that having IENs, and Dion can tell you, and Sue can tell you, and many of us can tell you, it's a blessing in terms of the expertise that IENs bring, in terms of the different perspectives that they bring, in terms of the camaraderie that they bring. I'm not putting down the graduates from home. They're also fantastic. IENs bring a different set of expertise that is so welcome and so rich for all of us to get to know. To the IENs, I want to tell you so you don't despair, because I have a hunch, Anna and Morgan, that at least 200 people here are IENs desperate to find work. I saw some of the notes there. I can tell you, although this program only will accommodate 100 IENs, I can tell you with no hesitation that when you become an RNAO member, and this is not to plug the RNAO membership, because in a couple of weeks you can join. First of all, now it's 75%. If you are an IEN, you may even join for free, but also in a few weeks you will have 3 months free that you can try it out. It does help you. The first thing I looked 30 years ago when I was director of nursing at Sinai, when I had fantastic people, I looked at their CV and say, okay, is this person, what does this person does in terms of their commitment to nursing? In addition to being good clinicians, if two people are equal, and I did look at RNAO membership, and I was not the CEO of RNAO, I can tell you also that RNAO makes a very strong effort to help IENs and help new graduates that are members in general also to become, to seek employment. So yes, this is through the program now, and with Anna and Morgan connecting directly. But if some of you will not get, I hope all of you get into the program. If some of you do not, keep trying and keep writing to us, because one way or another, we need all of you working. We need all of you working. So I don't want you to leave today thinking, oh, well, it's only 100 and I don't have a chance. First of all, go for it. Go for it. When is the form, Anna and Morgan, coming for the IENs themselves? When is that form, more or less?
We expect it will be ready on Monday. We're just working through some technical components of it to make sure that it works really well.
Fantastic, fantastic.
Should be ready on Monday.
So one more reason. Next week, we will be doing the In the Loop, which goes to all members, all of them. Morgan said we had 57. That is true, but we are almost at 60,000 this year. So here you go. It goes to all members. One more reason, join RNAO now. You will get the In the Loop. The form will be there, and it will be posted also on the website. So please, and do write in your CV that you are an RNAO member. People do look at that the same as they look IST organization, BPSO, etc. And I want to put a plug also for BPSOs, those employers that are not yet a BPSO. Please, please, please approach us. We are eager to have you all as BPSOs. You heard our colleague from KMH. We have 700 BPSOs in Ontario. So we want all of them, and all the organizations to benefit from evidence-based practice and people-centered care. Back to you, Morgan.
Yeah, so as Anna said, I did put the link to the employer in expression of interest form in the chat. So that's specifically for employers that are interested in learning more about the program. So lets us get some more information about you and gives us your contact information so we can connect with you. The intake for IENs should open on Monday. We will send the intake form out to all of the registrants for this webinar. And then it also will go out in the loop. So we'll go out to a large number of individuals, but we will make sure that it goes out to this group as well. And we are, there's been a couple of questions in the chat about confirming the eligibility criteria. So this program is specifically for internationally educated nurses who are registered already with the College of Nurses in Ontario as an RN, who are not currently working as a registered nurse in Ontario. The reason that that's the eligibility piece is because there are other programs that exist, although I do understand there are significant barriers and challenges in accessing some of those programs, like SPEP. It can be really hard to get a placement, but those are available. So this is to help to fill the gap after somebody who's internationally educated becomes registered with the College of Nurses, to allow them that Ontario placement or Ontario work experience and to build their network. So that's the eligibility, which I understand.
Morgan, can you comment, because I am hearing this as an IEN in purpose. I could hear you mentioned the issue of previous experience in Canada. I think it's important to mention that that's not a drawback, right? Because that's one of the challenges people experience. Can you share a little bit about that?
Sorry, can you, about the
previous experience in Canada that you said, you mentioned?
So it's intended to support IENs who have no previous work experience as an RN in Canada. The reason that it's designed that way is because we've heard from a number of IENs through career coaching at RNAO that that's what they're hearing as a barrier to employment. So they're applying to hundreds of jobs and rarely hearing back. And when they do hear back for an initial screening, and resume review, when they identify that there's no Canadian RN experience, they get told, I'm sorry, we're looking for someone who has experience. So the intention of this program is to give IENs that experience, so the ability to have work experience in Ontario, so that they can then build their network in Ontario. The intention, the intended outcome is employment. So we are looking, that's why we're looking not just for one or two employer partners, we're looking for employer partners across the province, because we know, the job market can be difficult at times. So we want to really have a broad network of employers so that we can match IENs for their placement with places that actually have an intention to hire RNs in the future. So that's why we're looking for a large number of employer partners across the province, so that we can help actually optimize the employment outcomes at the completion of the placement.
Morgan, can I augment and correct me if I am incorrect? Can I augment by saying that's the priority? But if you are an employer and you want only with previous experience, let us know too, because in case that we have spots and that we still need. And if you are an IEN and you had one job before, but cannot find another one, as long as it was not 10 years ago, right? But so that in case that we don't reach the 100 seats, that we can also connect with you. So fill the form anyways, it will not hurt, but it is focused on IENs, and you will have hand-holding all along. That's the beauty of this, a hand-holding from staff at RNAO that will walk you through it, documents, materials, support, both in Morgan, in Hannah, and in others that will be dedicated to you to help you, if I may. Thank you.
Yeah, so there's a
there
lot
are
of
a lot of hands. What do we do with them?
A lot of hands, and then also a lot of questions in the chat. A lot of questions in the chat about eligibility. How do we register? How do we get involved in this? A lot of questions about SPEP. A lot of questions about there's a lot of questions. So we will, just to clarify, the IEN intake form will be sent to you by email probably on Monday. Even so, if you have experience as an RPN and you can't get a job and you're registered as an RN but can't get a job as an RN, please make sure you still apply. If you had a previous job as an RN, for some reason left that job and are not currently working, please make sure you apply and fill out the form. If you are not eligible, we will get back to you, and we will connect with you about other kind of possible opportunities that we can provide and other resources and supports that are available through our recruitment and retention program to help support IENs, as well as Ontario educated nurses. So even if you're not eligible, there's still other supports. They may not include placement, but there are other supports that are available, and we would be happy to connect you with those. So fill out that form.